Okay, I think time for us to start, even though some other people are joining us. Well, greetings to all of you from Geneva, where we are blessed with sunshine today. My name is Susanna Zamataro, I'm the Director General at the International Road Federation, and it's really my great pleasure to welcome you to this webinar being jointly organized by the International Road Federation and the High Volume Transport Program. Now, you may want to know why a road federation like the IRF gets mingled with public transport. Well, simply because whether you walk, you cycle, or you take public transport, you will always end up on a road. And it's important that we make sure that infrastructure is able to meet the needs of people using it. But more importantly as well, it's because we as a federation, we're firmly committed to the vision that sees transport as a truly multimodal system that is, of course, safe, that is inclusive, and it is sustainable. And recovery does offer us some great opportunities to change the way we have been doing things. In line with this vision, and thanks to the support from the High Volume Transport Program, IRF has created a COVID-19 knowledge repository on the Global Transport Knowledge Portal, the GTKP, that has a specific dedicated section about inclusive transport. And this webinar is actually part of a series of webinars that IRF and the High Volume Transport Program will organize in collaboration with others. And we hope to reach and connect with many of you as possible to deep dive into some of the critical issues that the pandemic has simply made more evident or urgent to address. Now, without further ado, let me introduce our moderator for today, Anne Fry. Anne is an international specialist on mobility needs of disabled and older people. She works as an expert advisor to governments and transport providers, both internationally and in the UK, on mobility options for people with physical, sensory, cognitive, and mental health issues. And part of her work also focuses specifically on low and middle income countries. Of course, I'm not making justice to the amazing experience and 30 plus years of experience that Anne has today, but it's with great pleasure that I welcome Anne to the stage and thank her for accepting the invitation to moderate the session today. Anne, if you want to switch, yes, there you are. Welcome, yeah. Anne, and the floor is yours. Thank you.
Thank you so much, Susanna, and a huge thank you to the International Road Federation for having the suggestion of this event and for helping to pull it together with the High Volume Transport Program. Let me just very briefly tell you about the High Volume Transport Applied Research Program. It's funded by UK Aid and it undertakes research into sustainable transport development in low-income countries across Africa and Southeast Asia. And it's done a lot of work specializing in disability, understanding the issues, and in particular, the focus that we have today, which I know is a focus both of the IRF and of the HVT program, is how we can enable disabled people to be driving the agenda in terms of improvement. So it's not about what's being done for them, it's about how do we put them in the driving seat of what needs to change. Let me just do one or two domestic points. The first is that this event is being recorded. You need to be aware of that, but it does mean that it will be available for people to see afterwards. There should also be closed captioning available. I hope you know how to access that. We are asking everybody please not to use the chat function. The reason for this is an accessibility one, that for anyone using a screen reader, automatically it will read out everything that's in chat, which of course cuts straight across all the presentations and makes it very difficult for people to participate. So please use Q&A if you want to obviously ask questions, make comments, and we will then draw from those when we get to the discussion session, which I hope will be a lengthy one. So please focus on Q&A and get ready with the questions. We will take the three presentations and then go into questions and discussion after that. So if you've got burning questions from each of the presentations, please hold on to them until we get to that point. Because we only have an hour for the event, I'm going to move straight into introducing our three speakers. And what we have is, first of all, a research academic perspective on what the key issues are, setting the scene, if you like. Then we have a very practical first-hand view from Kenya on what the reality is about. And then we have information on some work that's been done and indeed nearly completed on giving guidance, information, how to enable people to address some of the issues that we've heard about. So I'm very much looking forward to that. Let me go straight to our first speaker. Dr. Maria Kett is Associate Professor in Humanitarianism and Disability at the UCL Institute of Epidemiology and Healthcare. She's an anthropologist by training and has done a lot of work, particularly in this field. So we're delighted, Maria, that you're with us. And let me hand over to you.
Thanks, Anne, and thanks for inviting me here. As you can see, I'm not necessarily a transport specialist, so it's really interesting to be here. And I'm going to present on work we did for the high volume transport research some time ago now. This was around, I want to say it was about 2020. We published a paper called Disability, Mobility and Transport in Low and Middle Income Countries, and it was a review of what we knew about the research, and I want to sort of talk a little bit about some of the findings. And we can go to the next slide, please. A little bit about why this was important, what we found, and what needs to happen. Next slide, please. This is in the context. Most of my work, as Anne says, have been in low and middle income countries, and I'm by certainly no means a transport expert, but I'll explain to you a little bit why I think it's important to our work. But just to sort of remind everyone that this is in a framework of the UN Convention on the Rights of Persons with Disabilities, which actually Article 9 enshrines the rights of persons with disabilities to access transport on an equal basis with others. But obviously we know there are many barriers to this. Some of those are institutional, such as legislation or lack of political will, policies, etc. Environmental barriers, infrastructure, lack of vehicles, lack of information, etc. And of course, attitudinal barriers, such as those of transport staff, other passengers, accessible information. And of course, the really important to think about this is this really does depend on how countries will be able to deliver this. Obviously, the higher income countries have very different sort of adaptations and possibilities to do what the UN Convention calls reasonable accommodation, whereas in lower middle income countries, those resources may be less available and accessible. But I think it's really important to remember that there is this framework in place. So when we're thinking about doing, how we're doing, whether it's road transport, etc., how we're doing this is really inclusive of people with disabilities, because over 182 countries have signed up to the UN Convention on the Rights of Persons with Disabilities, and it underscores approaches such as universal design, participatory design, etc. Next slide, please. So why am I interested in transport? A lot of my work, for example, has been around education. We really noticed in some of our projects that actually, although of course a lack of transport is not the only factor preventing children with disabilities from going to school, it's a significant one, and it really can make the difference between a child going to school or not going to school. And this was a project we did with Leonard Cheshire, which was a large UK disability charity, where we looked at actually including a transport solution in an inclusive education programme. There's a lot to say about this research, and we've already published on it. So just to say here that we know things like costs of transport are a barrier. Again, often not thought of when we're thinking about education, because we don't always think about how do children with disabilities actually get to school. So it's an indirect cost. Distance from home, again, much debate about what a long distance means, but certainly the top picture illustrates a very bumpy road in, this was in Mashonaland West, a very poor province in the northeast of Zimbabwe, with really poor road infrastructure. And of course, there's often a lack of transport to go to school. In this project, the community themselves designed a vehicle, and you might see it at the bottom. It's actually sort of motorbike with a trailer behind, which we can debate and discuss about the use of that as a means of transport. But again, it was designed by the community to try and address the issue of school accessibility. And I guess one of the issues we might think about it is, how these are sustained over a longer period of time. It did, and the research showed it did increase access for children to go to school, so it had that benefit. Next slide, please. Again, I've also worked in Liberia, and again, this was part of a much larger piece of work that we were looking at, quite a complex survey trying to match households with people with disabilities with non-disabled households, because Liberia is a very poor country. When we're looking at things like access to transport and poverty levels, almost everyone is significantly disadvantaged in terms of poverty. But what we were trying to really do was look at things like intra-household inequalities. And what we really saw, so we certainly know that people with disabilities face barriers to transport. There's very little, public transport in Liberia. There have been a few buses in recent years, but the majority are things like taxis or motorcycle taxis. But what was really interesting about our findings were how that it was often the disabled household head, who is often male, had more access to transport than perhaps other people in the household, which included, for example, women in the household. And that's often really related to who has decision-making power about choices about how money is spent, etc. But the point really is that there was a lack of access to transport in general. And of course, we've touched upon this. Next slide, please. COVID has changed emphatically, I think, all of our ways we think about transport, whether, the fear about public transport as a vector for transmission of disease, or actually, we've stopped using transport and found alternative measures. And we know that the HBT programme has done a lot of work around this. So I'm not going to speak too much about that. But I think there are two things that are really important to take home from their research. One is about the lack of voices of people with disabilities when they were thinking about what solutions to be done in the time of COVID. And the second was that people have actually been quite resilient and found new ways of getting from door to door. So they found new, whether that's rickshaws, motorbike taxis, whatever, to make those journeys that they needed to make. Okay, so back to the review. So the review showed a number of gaps or issues that were really coming up. And I think one of the first ones was actually, although we think we know about this gap in transport, actually the research shows there was a lack of data around travel behaviour and experiences of persons with disabilities. So actually it's very hard to measure because we didn't have the data to prove or disprove some of these issues. Obviously, we know that there are huge transport infrastructure gaps, and I'm sort of cautious. I don't want to over-focus on the environmental aspects, although of course they're important. But as we see from the first slide, it's not just about environmental barriers, it's policy and attitudinal as well. So although transport gaps are a huge problem, it's not the only problem, and we don't want to focus solely on that. Of course, things like the types of journeys people make, the distance of people journeys they make, in many of the lower middle income countries we looked at, public transport isn't really an option, or if it was an option, there were many barriers to that, such as the drivers themselves, who are on often short-term contracts and have to get a certain number of passengers in a certain number of times. So stopping to pick people with disabilities up, for example, is often, the willing, they may have been willing, but the way their contracts are is not possible to deliver those services. Subsidies, again, this is a huge issue. Very few lower middle income countries, South Africa being one of the exceptions, have subsidies for accessible transport or transport for people with disabilities. And how that's delivered, some countries such as the UK have a universal age, over a certain age everyone has reduced subsidised transport. That's not possible or available in every country. So how do you deliver transport subsidies? Again, measuring access to services, and we've talked a little bit about this, about the patterns, and again it's very difficult to, oftentimes where transport service surveys have been done, they don't necessarily break down beyond just one category of disability, for example, rather than looking at across different age, sex, gender, etc. profiles. And that brings me to the sort of last point about intersection and inequalities. We know that disability, like gender and age, cuts across all of the sort of issues around access to transport. I touched upon it in Liberia. But what we do know that largely what it's done, most research to date has often been comparing disabled with non-disabled, rather than looking within the groups, like as I was just talking about, so women with disabilities compared to men with disabilities, for example. So we don't know what works terribly well in terms of interventions for different groups of people with disabilities, but what we do know isn't that there isn't a one size fits all. But there were some nice ideas coming out of the literature. I want to talk about some of these. I've already touched upon the idea about transport services, such as special transport or paratransport, it's called in some countries. And again, we know that these are, that they're much discussion about how they're funded, but we also know that they're not in and of themselves a solution. They have to be part of a wider package, that it has to be part of, you know, changing people's attitudes and etc. And also there's a whole range about, you know, lots of moves now to be thinking about sustainable, healthy transport options, and certainly STS tends not to be in that. So we've already seen that transport can't be seen in and of itself. It has to be seen in the wider ecosystem, whether that's, you know, so for example, the education system often doesn't think about the transport of getting children to school, or the healthcare system. So we need to think about this in a much more holistic way. One opportunity, and I'm not going to spend too much time talking about mobility as a service, but mobility as a service is a way of offering door-to-door transport solutions, joined up transport solutions. Again, it's an emerging idea. It wasn't designed specifically for people with disabilities, but the whole idea about a flexible sort of door-to-door transport service is of course can be a great enabler for people with disabilities, as can technology. And there are many things that are available, apps for phones, etc., to support access to transport for people with disabilities. But again, we come back to this point that technology is an enabler. It's not enough in itself, and it still has to be in this wider ecosystem. So a number of other things that we know are needed. We know that we need a very conducive policy environment, but it's not enough. You still need more. We don't know the exact size of this gap in terms of access to transport for people with disabilities, and so we do need more research in this area. And we also know that those travel and access needs change over time. So again, it's not a one size or one stop shop. In terms of future steps, next slide please, we need to be having much more work done to support adults and children with disabilities to use transport, but again must be in the wider ecosystem. We need a much better supportive policy design, thinking about things like universal design, but actually the mode of transport isn't, as I keep saying, the thing that makes the biggest difference. Obviously accessible transport is important, but actually for people the biggest issue that makes a difference to their lives is whether it's convenient and that they have a degree of autonomy about choice. So this is where things like paratransport or you know, special transport is quite difficult, because you have to arrange it ahead and it has to be done at a specific time, and it really does change people's sort of ability to be flexible and autonomous. Next slide please. I think we're on number 11, just so you're keeping up. In terms of approaches, some of you may already be very familiar with the twin track approach, which is really both mainstreaming people with disabilities and services into regular transport services, but also providing specific support when needing. So for example, we know we need to think that buses and minibuses need to be accessible, but actually in some cases we also need to actively incentivize the drivers to be more aware and willing to pick up people with disabilities. And I think some of the gaps we really noticed was this absolute lack of the voices of children and adults with disabilities themselves. So there's a lot of research done on or for people with disabilities, but very little is actually done with or by people with disabilities. And again, thinking about a whole range of impairments and really thinking about how people are included in, you know, access panels, audits, etc. The last point really to think about is that there are, as I said, a whole range of technologies to facilitate inclusion. But again, we really need to think how transferable those are into lower middle income contexts. And I think we really need to think about that we're talking about inclusion, we're talking about much more than access. It's a much wider discussion when we think about inclusion more generally. And Anne, I have finished, and I hope I have managed to be in time.
Thank you very much indeed, Maria. That was a very comprehensive trawl through the research and some of the fundamental issues. You packed an awful lot into a short space because we're limited on time, but just to remind people, you can access the recording of this whole event if you want to take time to go through some of that excellent material of Maria's again at your leisure. Can I just remind people again, please, don't use the chat function, simply because any of our delegates who have vision loss and are using screen readers, the chat automatically reads it out, so it stops them listening to presentations. Please use Q&A whenever you like, comments, questions, and we will pick those up at the end of the presentations. Let me move on now to our next speaker, Bright Oyuwaya from Kenya. Bright is the Executive Director of the Association for Safe International Road Travel, which is a not-for-profit organisation promoting road safety. She is also, among a lot of other roles, she's a board member of the International Road Victims Partnership, and is the Vice Board Chairperson for the Association of the Physically Disabled of Kenya. She does a lot of advocacy work, both nationally and at international levels. And Bright, let me hand over to you. Thank you.
Thank you very much. Let me share my screen. Yeah, thank you. And as I do this, yeah, I want to tell everyone that I'm a person with disability, having acquired a disability 24 years ago through a road crash. So I kind of have a license to give you an experiential approach to approach to this presentation. But I will begin with a disclaimer that I am going to focus on road transport. And also a lot of the work that I'll use is from physical disability, but I also want to believe that a lot of these issues are cross-cutting. So in Kenya, the policy and legislative environment is such that first we ratified the UN Convention of the Rights of Persons with Disability in 2008, very early in the days. We subscribe to the SDGs 3.6 and 11.2, and 11.2 specifically talks about inclusion of vulnerable groups, including persons with disability. Our Constitution 2010 has a Bill of Rights section that is very expressive about access and mobility, actually. The Disability Act of 2003, though its implementation has been stalled a little, expressly talks about access to transport. And the question we might be asking from a person's with disability perspective, why is inclusion necessary or even important? It gives us access to education, employment, healthcare services, social activities, and the likes. And it also breaks down that downward spiral of dependence, because if you don't have accessible transport, it means that you'll have to depend on someone else to lift you up, to carry you up, to walk with you. Also that there is an economic cost for exclusion, because when people are not educated, when they are not employed, when they don't go to school, then the ultimate is poverty. Again, it is very clear that access to transportation supports equitable and inclusive social development, just as I have mentioned before. And you can get quite a direct link between transport and sustainable development, because transport is an enabler. What is the reality from paper now to our reality? This is the normal, the everyday public transport that is used in my country. It's called matatu. And you can see a lady on a wheelchair, and you can try and figure out how they'll ever get to that vehicle. You will see the picture below. She will have to be carried into that vehicle, and that leads to loss of dignity. The other picture is of another friend of mine, and I think she's even logged in with cerebral palsy, limited use of her limbs. And look at the distance between the ground and that matatu, as I said, they're called, is very high. So she needs support. She walks around with an aid when she can afford it. When she can't afford it, she would need to have the conductor's help. And she tells me sometimes they're rude and not helpful. And then lastly, in that particular segment, you will see a person with disability fighting for space with other vehicles. Infrastructure is a big deal, and Maria did mention it's one of the issues. This is a road in Nairobi. There is an attempt to put a walkway, but as the walkway is put there, there are boulders and pillars. Imagine if a person with visual impairment is using this road by themselves, then it's disaster. Even I, as a person who uses a wheelchair, then this becomes very hard for me to use. There's also the issue of lack of enforcement. There is a walkway, but it is now a parking lot for vehicles. Then there is also a situation sometimes when there is just no provision, and people with disability, especially physical disabilities, then would find it very, very difficult to use the roads. This is a friend of mine again, one of my colleagues, needs to cross from one side of this road to the other. And you can see there's no provision whatsoever for a wheelchair. And see the raised walkways, the traders along the way. there is a ramp that he could use to cross over, but he could not do that because the place where you can get to the ramp is occupied by traders. So there is, it's not possible for him to get to the other side. And this is the beautiful ramp and bridge that he needed to cross. So that becomes impossible because of those barriers. There's also the issue of data, and Maria has very ably talked about that. Inaccurate data, so planning and implementation becomes an issue. And then COVID just came in to show us a different, some of the emerging issues like touching surfaces. When you tell a visually impaired person there's social distancing, yet their hands is what they use to touch and feel and know while entering the public transport. We have seen that people with wheelchairs have to be lifted into vehicles. So how safe is that in the midst of COVID? And therefore, generally planning and implementation gaps are very, very, very clear. But there are some initiatives that have happened in the past, like my organization has been involved in campaigns. And this is a campaign during the World Day of Remembrance where we articulate our issues, we speak to policymakers. This is the middle of our city, the central business district. We see walkways, cycling lanes. This road has been complete and it has all that, and therefore everybody is able to access. This means that where there is intention and political will, then this is possible. And then the last picture there is the National Gender and Equality Commission together with ITDP having a campaign. They were trying out, and these are Kenyan parliamentarians on wheelchairs, trying out the only bus that exists and belongs to the Kenya Institute of Special Education that is wheelchair friendly. What then? I think I know that there's need to engage people with disability, to understand their needs and their priorities and plan from their perspective. These I have said, include them right from the planning, designing, right to the implementation. There are very low cost solutions that don't need a lot of resources. And many times our policymakers tell us we don't have resources. Removing obstructions from footpaths, from the pictures we have seen, and in bus stops is just a very basic thing that can be done to make it possible. Easy to flow and audible route signs. Sometimes people with visual impairments using their walking canes do not know where they are at. And if we had audible signs, then that would be something that would be useful. And there is also tackling of mobility at the most basic level. We talk about mobility outside our home states. How about appropriate access? Wheelchairs, mobility devices also are not very accessible to many of our members. So universal access principles in designing, constructing of sidewalks to ensure that people with disabilities can actually access. We need accessible vehicles. We, as a country, we are at the place where we are discussing BRT, and it is meant to have accessibility for persons with disability. So this really is our only hope. As we speak today, there is none. There is no public transport that is accessible to people with physical disabilities, especially with wheelchair users. So in essence, what I'm saying is if there has to be inclusion, we have to be included in the planning, we have to be included in the policy, we have to be included, the transport has to be available, it has to be accessible, it has to be affordable, because sometimes persons with disabilities, especially physical, are charged twice at the bus stop. They're told, where do I keep your wheelchair? So you have to pay for a seat, and therefore you'll be charged twice. And then the safety, you have to be manhandled, you have to be handled by people you do not know in the form of assistance. So really, I will stop there, and I hope I've been able to keep within my time, but I'm available for questions as we move forward. Thank you very much.
Thank you so much, Bright. What a very vivid presentation of some of the day-to-day reality that faces people with disabilities in different countries. I think that's been a very, very clear representation. I'm seeing that some people are putting hands up. We're going to hold questions until the end when we've had all the speakers. And again, if you can use Q&A, please do. Don't use chat, but use Q&A if you would. And we'll pick people up as we go forward. So our final presentation, we are finally going to allow some men to participate after this all-woman session so far. And we have two men doing a double act, essentially. Let me introduce them both briefly. Subhash Chandra Vaishnav is an accessibility, universal design, and diversity and inclusion specialist based in India. Among many other things, Subhash is founder director of the Center for Accessible Built Environment Foundation. And he has, I know, done a lot of work, not only in India, but around the world, and is one of the leading pioneers of accessibility. The other speaker in this next session, Tom Fleming, is an associate with ITP's Transport Policy and Strategy team, and has done numerous studies focusing on disability. Subhash and Tom, between them, will be talking about the not quite ready, but almost update of something not very excitingly called Road Note 21, but in fact, it's going to be a resource on a lot of the solutions that we need to apply in countries like Kenya and many other parts of the world. So it's, if you like, it's a handbook, it's a resource that's coming on stream. So let me hand over Subhash, I think, first, and then Tom, it's over to you. Thank you.
Thank you, Anne. I will share my screen and then hopefully Subhash can kick us off. Hopefully you can see the presentation.
Yes. Thank you so much, Anne, and thank you, Tom. So the slide that you have, we're going to be talking about the Road Note 21, which is enhancing the mobility of disabled people, guidelines for practitioners. And the next slide. So in next few slides, the current slide actually summarizes how the presentation will cover. So the next slide will be, what is Road Note 21, the purpose of this guide, why was this revision needed, and who were involved, and what has changed in the Road Note. Next slide. Thanks. So originally, the Overseas Road Note 21, it was published in 2004, and it was produced by the Transport Research Laboratory for UK's Department of International Development. Now the DFID has been merged with UK's Foreign Commonwealth and Development Office called FCDO. And so therefore this guide is now going to be published as a FCDO document. The ITP, the Integrated Transport Planning, Tom Fleming represents that here. It was commissioned with partners to update through the HVT program. And this new guide is expected to be published in March 22. Next slide. Thank you. So the purpose of this guide is to basically improve access to transport and reduce mobility barriers for persons with disabilities. And the focus is, of course, on the low and middle income countries, but the principles that are used in this to promote inclusion and universal design are applicable to any environment, whether it is city or a rural setup. The primary audience right now is transport policymakers and practitioners. But as I said, it has much wider appeal. It can be used in not just low income countries, but across the board. And these are wonderful guidelines. Next slide, please. As I said, the last document was of 2004. So a revision was needed because the original guide was almost like 20 years ago. So, since in last 20 years, so much of understanding about disability has evolved. We have moved from the charity to medical model to social model today. And we are talking of that disablement happens because of the environmental barriers around us. And if environmental barriers can be addressed, persons with disabilities can easily take part in the community and be active right holders and use all the rights that are available to them. The UN Convention, as the first speaker has already indicated, the UN Convention on the Rights of Persons with Disabilities, it was developed during this time. And today it stands ratified by over 184 countries. and many countries have evolved their own laws also, which are harmonized with the UN Convention. For example, if I can talk of India, we have a Rights of Persons with Disabilities Act 2016, and most of the ministries in Government of India are coming out with their own accessibility guidelines as to how they will respect and implement the Rights of Persons with Disabilities Act, implementing the UN Convention. Most of the organization and case studies that was referred to in the last 2004 version of the Overseas Road Note 21, they no longer exist. In fact, many of them have been replaced, and there is new knowledge available in the countries because persons with disabilities, the DPOs, and the governments have been negotiating this issue, trying to address this issue in their own ways. And so much of knowledge is already available through that practice. And that was one major reason that this was needed to be updated. Another reason was that this guideline was in a PDF format. And because it was so old that it was becoming increasingly difficult to search for it on the internet. And today is the age of internet. And in case, unless it is your guideline is good, higher in ranking, you are not able to search for it. So I think these were the various reasons why the revision was needed. And I think I'm going to be asking Tom Flemings to detail out what has changed in the entire guidelines and what new perspectives have been brought out. Tom.
Thank you, Subhash. Apologies, I think there might be a little bit of a lag on me changing the slides there, so apologies for that. But I wanted to begin just by giving an overview of the team that was involved in the update. So Subhash was one of 5 key experts, so disability transport specialists involved in updating the guide. The team was led by my colleague at ITP, Neil Taylor, who's got approaching 20 years experience in disability, transport disability policy and strategy, development and research in the UK and internationally as well. And colleagues Nick Ayland and Colin Brader at ITP. Colin, interestingly, is a public transport specialist rather than a disability specialist, but work with extensive experience working in low and middle income countries. And so he sort of brought a unique perspective to the team there. And then, in addition to Subhash, who is a practitioner based in India, we have Crystal, who is based in Kenya, who has lived experience of disability and was able to really sort of contribute and bring that understanding to the guide's development. So in terms of what's changed, I mean, for those of you who are familiar with the guide, the original guide is 190 pages long. It's a substantial document. It's encompassing of sort of all surface modes of transport. Our objective was not to to reinvent the wheel. We were dealing with an update to an existing document that in many respects was very good, had sort of good knowledge, good information, as Subhash has mentioned. Because of the time, the 20 years that had passed since its publication, it really did need a comprehensive refresh on case studies, on images and so forth. But one of the challenges was actually the structure of the guide and how it was presented. There was probably an aspiration maybe to shorten it, but I think, and to streamline it. But I think we realized quite quickly that maybe wasn't going to be possible because of the need to kind of bring in new thinking and new best practices. So it was really about how we can organize the content and make it as accessible to as many people as possible. So we alighted on a 2-part structure, which 2 parts that function as 2 sort of independent standalone documents, but equally serve value being read together. The first targeted at policymakers, which interestingly covers a lot of the content that's been expressed and discussed already in terms of policy, in terms of barriers to disability, but also sort of leveling the playing field really on knowledge in terms of prevalence of disability, different categorizations of disability, visible, non-visible disabilities. And then part 2 is the sort of where or the good practice guidance sits. It's the most substantial part of the guide. It's where there's a lot of sort of more sort of engineering focused information on standards. So there's a lot in there. It encompasses all modes, which we won't get into for this presentation today, but we did identify some notable additional areas to be covered. So the first was school transport services, and speaking to one of the authors involved in the original guide back in 2004, he felt that was a notable omission from that guide, and therefore we felt that its inclusion in this iteration was worthy, and also urban water transport services, because I think we mustn't forget that water transport can play a really important role in the public transport systems of many cities in low and middle income countries as well. Also updated lists of advocacy organizations, best practices, so on and so forth. Also best practice resources, so various design guides that have been published in the time since, some of which we've drawn upon in some of the content that's presented in the new guide. But then more widely, there's greater emphasis on neurodiversity, greater emphasis on non-visible disabilities. These were not necessarily covered to the extent in the literature back in the early noughties that they are today. And part 2 is organized around 3 core themes of accessible vehicles, accessible infrastructure, and accessible transport services and information. And particularly in regard to the latter, there's a lot more to draw on in terms of best practice now with digital technology, also concessionary travel, which Maria touched upon. Bookings, reservations, information journey planning, and also there's a dedicated section there on universal design as well, which we thought was important. It was sort of scattered through, if you like, the original version, but we thought giving that greater prominence would be important. So just to wrap up and to say that the new guide is coming soon, hopefully very soon, hopefully in the next within the next month, and we look forward to presenting it to you, and we look forward to receiving your feedback and your thoughts on it. So yes, thank you very much, and Anne, I'll hand back to you.
Thank you very much indeed, Chairman Subhash. And I think we all look forward to seeing that document as soon as it's available. And let's think about a way perhaps that we can make sure it is available to all of you who are participating today, because I think it's going to be a very useful toolkit, both for those with experience of working in this field and also for those coming new. And I think what's come out for me in the presentations is very much that we are in many countries still making the same mistakes that we were making not just in 2004, but also way back in 1994. So we need to be learning from what other countries are doing, what other areas are doing. And I think this will be a useful way to do that. Now, we don't have a lot of time, but let me move straight to the questions. And I want to start actually with Bright. I have 2 questions for you. The first one was, from which countries are Kenya drawing expertise for your BRT? For those who don't know, BRT is bus rapid transit. And there are appalling examples around the world of money that's been invested in bus rapid transit that is not accessible. So Bright, who are you talking to make sure it's right for you in Kenya?
I'm not very sure, but I know that ITDP, the Institute for Transport and Transportation and Development Policy, have been at the center of this together with UN Habitat. I know there's been some benchmarking from our neighbors in Tanzania who've gone ahead of us, who already have a BRT system. So I'm not really 100% sure, but I know that there's a foreign country which I can't remember right now.
Okay, I think a strong message from all of us is absolutely make sure as a condition of funding that it is accessible, because once you've built a system like that that is not accessible, it's there for 30, 40, 50 years. And I think, am I right that Lagos is an example of one that is absolutely not accessible when it could have been? So hugely important before anybody starts telling you how it's going to be, that you get involved there. I have a second question for you, Bright, while you're on the screen, which is how can your organization support changes to the transport system in Kenya to make it more accessible to people with disabilities? In other words, what powers, what influence have you got to make that happen?
Obviously, it begins at advocacy, policy advocacy, and legislative advocacy. There's one of the pictures I showed where you saw parliamentarians with disability. We work very closely with them, trying to influence policy and policymakers. Just trying hard to make sure that your voice is heard, being present, being on the negotiating table, finding out what's going on, using whichever means. So influencing policy is where it begins, because if you're missing out on the policy framework, then implementation is minus you. So our organization is a generally advocacy organization for road safety and transport and disability. So that's the area of focus. And we believe that once the framework, policy framework is correct and we have the political will, and of course we have campaigns that call for that intervention when we feel that things are not going as quickly as they should. So that's just how we engage.
Thank you for that. I see that you've now had an offer from Pakistan to give you advice on BRT, bus rapid transit projects. So if you're looking at the Q&A, there's a helpful offer there. You know, that's the huge beauty of events like this, that we can share best practice internationally and help to avoid some of the mistakes. Maria, I had a question for you, which was, what kinds of disability were you engaged with in your research? Was it only about wheelchair users, or was it a broader set of disability?
That's a good question. No, it was a broader set. So we used search terms to include, to make sure we did, but it's, the detail is in the report. But yeah, but often there was some small amount of papers around people with autism, particularly around apps for things like helping navigate bus routes and things. So there is now a range of research around different impairment groups. It tends to be from higher income countries. So I guess the question is how transferable, and I know people have made comments already. Of course, this is the point, right? How do you, but how do you transfer some of these lessons? And I think you touched upon this, Anne, without making the mistakes. And I think that's a really key point. Technology transfer, if you avoid making all the mistakes in between, like too much reliance on fossil fuels, you can have a much quicker turnaround. So yeah, hopefully there's a range of impairments covered in there. It was a desk review, so we didn't interview anyone directly.
Thank you. And I think one of the key points to come out there, which was highlighted by Subhash and Tom, was that now we need to focus much more on issues such as neurodiversity, mental health issues, and a lot of the hidden disabilities that in past years, it was much more of a focus on wheelchair users, people with hearing or vision impairment, and that's hugely important still, but it's only part of the issue. I now have an interesting one for Subhash and Tom. We have had a comment question that the problem with the system being accessible is the exact details of what accessible is. The guidelines and standards that engineers work with struggle with the exact details of infrastructure. Even in South Africa, we are struggling. We have progressed a lot with guidelines. So I think the question really there is, how do we make sure that the right information based on research, based on practical experience, is shared among all engineers? I'm a great advocate of more training, but Tom, Subhash, what do you think?
Yeah, Subhash, do you want to go first? And
Sure. I think the huge problem is that the engineers do not have right standards and have no exposure to the standards. And they do not have much experience of working with persons with disabilities or involving persons with disabilities into their work. The best would be whenever they design, they should refer, ORN is one great example, the Overseas Road Note. But each country has these standards. The only thing is that they need to be exposed to the standards, and they should work along with people with disabilities and have constant feedback when they're designing it. Very often when you don't engage people with disabilities, you end up making very silly mistakes.
Absolutely, absolutely. Tom, did you want to add to that?
Yeah, I just said in the context of the design guide that we're developing, it's not really the intention to sort of prescribe what is accessible and what isn't accessible per se, but it's really to enable thinking to take place around accessible design, and then hopefully some of the resources that we have that are embedded within the document that may be specific to standards of different countries, for example, can be used then to inform the development of better local standards. We see this as a document that sort of that does that rather than tells people what is accessible and what's not accessible.
Thank you. I think, I mean, to me, the underlying problem is that we still, in every country, including the UK, it is possible to qualify as a civil engineer, a highways engineer, a mechanical engineer, with no understanding of disability or inclusive design. One thing I'm working on in the UK is to try and make it an absolute non-negotiable requirement. If you want to be a professional in the highways transport industries, or indeed an architect or any other profession, you must study and understand inclusive design. And to me, that would be quite a breakthrough if we could achieve that. But so far, to my knowledge, we haven't quite got there. But I'm still on the case. And maybe we can use the new road note as a sort of stepping stone to try and encourage that and develop some training programming behind it. I had another question here from for Bright about whether government subsidy could be a solution for the matutus to be inclusive for people with disabilities in Kenya. Do you want to take that one, Bright?
Yeah, first and foremost, what I need to highlight is the fact that these matatus are privately owned. So the country doesn't have a public service system that is government propelled. So I believe the first place to be is to have a public transport system that is run by government. But maybe, yes, these are profit-making organizations with incentives. I believe that they would be in a position to then be more inclusive and consider all users. For example, with the BRT, I understand that they have been given an opportunity to participate by owning some of the buses. So that's already something that is giving them incentives to be inclusive and to have accessibility.
Okay, thank you for that. And I have a point here from South Africa. We need more support with research and funding. Where could we go to get assistance? There is so much we need to do. I don't know whether anybody actually is able to answer that from our panel of speakers. I think it's a very common need and a very common issue. And along with the need for better training that I was talking about, we also need to educate the politicians, I think, to understand that investment should be all about accessibility and inclusiveness, because the cost of not making things accessible is infinitely higher. So there's a lot of work there to be done, but I don't know if any of our panelists want to comment on that. You know, how do we get those resources flowing? Any takers on that? Tom?
I'd echo that, Anne. I think it's about getting the conversation going with the power, the powers that be, and often we find that sometimes quite good standards exist or quite good policies or laws are in place. It's just then about actually implementing them in the way that they ought to be. But yeah, it's a challenge. Funding's a challenge, and it's about. It's often a competitive process. It's a sort of trade-off between funding needs, and it's about making the case that actually, like you say, the cost of not acting and not making environments accessible is a lot more significant than of not making, not sort of putting these systems in place to start with.
Indeed. Subhash, do you have any suggestions from the Indian context of how to get money flowing directed at accessibility?
I think in Indian context, the law is already set in motion. So many a time what happens is the agencies who are purchasing these transport equipments, they do not insist on accessibility sometimes. So we have a very strong user groups. In fact, I can tell you in last 1 year, there have been at least 3 public interest litigations in the court of law where the entire purchase was halted because it wasn't accessible. So that is one way of advocacy. Other thing is we very often equate high cost intensive equipments only to be accessible. In low resource setting, definitely accessibility and universal design is something that can be always thought of looking at the resources available. You need not to go for all the time the high intensive options like metro services. There could be buses which could be accessible. So eventually the politicians and the users need to look at what are the resources available, and the universal design approach with involving user groups is ensured. Then things can actually fall in place. We don't need to really be looking at all the time, a high cost intensive investment into this subject.
Thank you. And it's interesting to hear that you are taking the legal route in India. And I think, it's been so easy for people to sign and ratify the UN Convention and pass laws domestically. But there's a huge gap very often between saying, oh, yes, we've got laws in place, and actually monitoring and enforcing those laws, which is completely fundamental to it. Somebody's actually made a comment now to me, I'm afraid we're nearly out of time. The Equality Act in the UK covers inclusive mobility. Most of the highway engineers are well versed, I think. I wish I could agree with you on that. They should be well versed, but actually when it comes to the understanding of what needs to be done and why it needs to be done, we still have a huge gap there to cover, as many countries do. We're almost out of time, but let me do one last one very quickly, I think to Maria. Should we be lobbying funding agencies such as the World Bank to ensure that any projects they lend on are inclusive and educate their own project staff? Can you give me a 30-second maximum answer on that, Maria?
Yes, because they absolutely do intend to do that. The World Bank have committed to this in the same way as many other UN agencies and bodies have. So yes, and it's just a matter of, as you said, Anne, of joining it up and making sure that those working on disability inclusion know what those other departments, so often they're very siloed. It's really thinking about how inclusion is really, mainstreamed across all of those areas.
Thank you very much. A very last minute one has slid in about whether anybody has any experience of working with rural communities and rural infrastructure. I think that may be the theme for a separate webinar, because there's a whole range of different issues there that we need to explore. And I'm afraid I think we do need now to wind up today. So apologies if your questions haven't been answered, but thank you very much. I see we've had well over 100 people participating, and it's been excellent to hear your views as well as hear from the speakers. I think the main theme that has come out is that there is still a gap in particularly the way in which disabled people are engaged in advising on and delivering the right solutions. There is still far too much tendency to talk about what disabled people need rather than to ask for them to be in the driving seat of delivering those changes. So an enormous thank you to our speakers for some really interesting and illuminating information. And thank you particularly to the International Road Federation and to the High Volume Transport Programme for bringing this together. I'm sure it won't be the last such webinar. So if you've got any thoughts on issues you'd like to see explored in similar events, do please let the organisers know, and I'm sure they'd be happy to take those on board. Again, you'll be told, I'm sure, when the recording is available, so you can listen again and get involved at that point. So thank you all very much indeed, and have a good afternoon. Thank you.